Well, for the last several days, monkeypox has been a national and an international headline. There are global concerns now about its spread and the pace at which it is spreading. So do we really need to be worried? Where is this all going? Joining us now, Dr. Soumya Swaminathan, Chief Scientist at the World Health Organization. Thanks very much, Dr. Swaminathan, for speaking to us. I think the basic question is the fatality rate and hospitalization rates compared to COVID and the flu. How bad is it as far as monkeypox is concerned?
Good evening, Vishnu. Thank you for having me. I don't think it's right to really start the comparisons with diseases like the flu and COVID, about which we know a lot more. One of the reasons why the Director General announced a public health emergency of international concern is that not only is this an extraordinary event in the way in which it's been spreading over the last few months, but also that we understand very little about monkeypox and how it's transmitted and what the animal reservoirs are and why the epidemiology seems to be changing now. And so it means that we actually need to collect more information, more data, do more research, do better surveillance, and countries should report all of the data to WHO so that in the next few weeks, we can start understanding this disease better. And it's also true that for both COVID and influenza, the case fatality rates really depend on who's been infected, right, the age, the underlying conditions, whether they've been vaccinated or not, the strain of influenza that's circulating in that particular year, and so on. So many, many variables here. But just to reassure people that at the current moment, the case fatality rate of the monkeypox outbreak is very, very low. We have a reported 5 deaths out of the approximately 16,000 cases reported to WHO, and there are probably many more cases that are undiagnosed in these communities.
In fact, that really does answer my second question, how worried we should be about monkeypox. But what I'd like to do is move on to, what a lot of people really want to know about. Should there be a global vaccination program to deal with monkeypox? If not now, then perhaps inevitably in the next little while?
That's a very good question. And you know that the world, once smallpox was eradicated and smallpox vaccination programs stopped somewhere around 1979, 1980, the generation born after that has not received smallpox vaccine and therefore has no immunity. In a way, I would say this monkeypox outbreak may be a wake-up call for us, because we all the time have to prepare ourselves for deadly outbreaks. Now, the vaccines that we have today were basically made for smallpox, and there are now second and third generation vaccines. Nobody's going to use the original first generation smallpox vaccines, but there are very limited doses. Mainly, countries had stockpiled some of these vaccines in case there was ever a smallpox outbreak, either a biological or a accidental spread. So there are limited doses. There's one company, the Bavarian Nordic, which has a vaccine that was again developed for smallpox, has now been given emergency use listing by FDA and EMA and the Canadian regulators to be used for monkeypox. But I want to highlight that there really isn't any efficacy data on how it's going to work in smallpox. So the urgent need is to collect that data. Of course, the vaccine, we believe, will be effective. There is lab data showing that it neutralizes the monkeypox virus. And so there are already a few countries who have access to this vaccine that have started rolling it out. We hope that they can collect data systematically so that we know about its efficacy, but very limited doses globally. So it's premature to talk about a global vaccination program. However, WHO, along with our partners like Gavi, are talking with manufacturers to see how we can scale up manufacturing and also, make access to all countries. It's also very expensive at this point of time. So again, we're in a situation of very limited supplies.
I was speaking to Adar Poonawala earlier today, and there is this emergency purchase which he's personally making to India of this particular vaccine, and he says that it's possible, if bulk quantities arrive, for them to fill and finish it and then market it. India obviously has this incredible ability of manufacturing vaccines. Is India a likely destination for Gavi, the WHO? Should there be a need for a global rollout?
Yes, absolutely. I mean, I think, again, this is a sort of almost a practice run for something that could happen in the future. We've been talking about pandemic preparedness, and one of the things is how quickly can we scale up manufacturing, and India would play a very important role just because of the capacity we have. So yes, the Bavarian Nordic has about 16 million doses. These actually belong to US stockpile, but the US has donated some of those doses to be used in other countries. They need to be fill and finished. So certainly something we will explore is where we can get the fill and finish done, for example, at SII, but also if it's possible to transfer technology and start the manufacturing in other sites in case a global vaccination program will be needed.
Are you in talks at all with the Serum Institute or any Indian company?
Not yet.
Okay. Dr. Swaminathan, is monkeypox transmission mostly limited to sexual contact among men?
Not at all. I think we need to understand that monkeypox can spread through basically skin-to-skin contact, face-to-face, mouth-to-mouth, close contact with somebody who's infected, somebody who's got the virus either in the skin lesions or in the mouth and nose, and it can also spread through coughing, through respiratory droplets. And so it can spread to close contacts. They don't have to be sexual contacts. Currently, the outbreak we're seeing in Europe and North America is being driven by men who have sex with men, and the fact that they have a number of partners in a close period of time has helped, I think, to this virus to take off like this in that community. But there is nothing to stop this virus from spreading in the general community, particularly within families. It can be passed from mother to child. It can also be passed while an infected person is caring for someone else. So I think it is not a disease that affects only the gay or MSM community. That's not the mode of, obviously sexual contact is a close physical contact, and that's how this particular outbreak is being driven, but it can very quickly move in a country like India into a more generalized spread, particularly since we have such crowded settings in which people live.
Dr. Swaminathan, given the relatively low fatality so far, and one hopes that it stays that way, does the focus on monkeypox divert attention from other serious illnesses, for example, in our country, which, where we deal with the burden of poor health in so many ways?
This is a very good question, and I think something that the WHO has been talking about, resilient health systems, universal health coverage through good primary health care, building up our surveillance systems, and having enough human resource capacity to deal with these threats. These are going to become more and more common because of climate change, the loss of biodiversity, the frequency with which animals and humans are coming into contact, international, travel, which means that very quickly diseases can spread around the world. And so we need to be prepared constantly to be dealing with this type of thing in addition to doing everything else. So it should not be an either or, shall I do COVID or shall I do monkeypox, or shall I do non-communicable diseases or TB? It cannot be like that. Our health systems need to be able to deal with all of these things, and it is possible. When we think about universal health coverage, it means all of these things, and it means providing quality care. So it needs investment, mainly into people, but also into infrastructure, labs, and then, of course, other things like diagnostics.
Sure. And ma'am, a final question to you. Again, there are a few problems with comparisons, but I think for a lot of people in a wider audience would still do that. So the question is this: monkeypox versus new COVID mutations, what worries you more and what is potentially more dangerous?
Again, it's too early to try to speculate on what's going to happen with this monkeypox. Monkeypox is a different virus. It's not going to be mutating at the same rate as COVID. So it's unlikely that we're going to see the kind of rapid changes and the variants we saw with COVID. Of course, COVID also spreads through the airborne route, and therefore it was much easier for it to become a pandemic. Monkeypox, the one good thing about it is that it's easy to diagnose in the sense that the symptoms are very clear and obvious. And
right.
So public health measures should be much more effective. We need to track and surveillance and do the same kind of things we did for COVID, the sequencing, the sharing of the genetic sequence data, so that scientists can also start tracking. For example, we know this is the West African clade that seems to be spreading here. But when did it actually arrive in Europe? How long has it been transmitting, undetected? And are there further changes as it is spreading through the world?
Sure.
Again, we need this global sharing of data, but at the moment, we should prevent it from becoming a pandemic because we've got it relatively early. And we know what measures, we have the tools. Basically, it's the public health measures, the contact tracing, the isolation, continue to wear a mask and wash hands, etc., and isolate if you're sick.
Right.
And with that, we should be able to break these chains of transmission.
All right, Dr. Swaminathan, thank you so much for speaking to us again, laying this entire illness threadbare for the benefit of our viewers, people watching this program. Thank you very much indeed, ma'am. Thank you.
Thank you, Vishnu.